Welcome to Thriving with ADHD, a podcast where we'll share everyday practical tips to thrive in life as an adult with ADHD. This podcast is brought to you by Animo Sano Psychiatry, a behavioral health practice with a specialist ADHD clinic based in North Carolina. And this is your host, Nada Pupovac. Welcome to the new episode of Thriving with ADHD, dear ADHD community. Today we are talking about digital tools as medicine for ADHD with Dr. Scott Kollins. Dr. Kollins is a renowned expert in ADHD and deeply committed to enhancing patient care, quality, and accessibility. Dr. Kollins also serves as an advisor to Animo Sano Psychiatry, so it is a special honor to have him as a guest speaker at our podcast. Scott, a warm welcome to our Thriving with ADHD podcast. We are delighted to have you on the pod, not only as a well-known ADHD expert, which you are, but as a friend and supporter of our practice.
Thank you, Nada. I'm excited to be here.
Well, I would like to kick off with the first you introducing yourself. So tell us a bit more about your work in the field of ADHD.
Yeah, happy to. So my name is Scott Kollins, and I am a clinical psychologist. I have been working in the ADHD field since graduate school, which was a very long time ago. I guess I'm coming up on 30 years, well, I'm past 30 years from when I started. From my master's and dissertation all the way through my career, I've had an interest from a research perspective as well as from a clinical perspective in patients with ADHD. My work across all those years has been pretty wide ranging. Early on, I did a lot of work on trying to understand how the medications that we use to treat ADHD, how they work at a behavioral level. So I was doing psychopharmacology work. I then got very interested in understanding more about why people with ADHD smoke cigarettes and use nicotine more. So I did a lot of studies on that question and learned a lot. And then all along throughout my career, I've been interested in new treatment development and clinical studies. So I've been involved with clinical trials. Most of the medication treatments that are used right now to treat ADHD, I was involved at some level with clinical trials that led to their approval. And then, of course, the role that I'm in now is the chief medical officer to Killy, where we have an app-based video game that's FDA authorized to treat ADHD. I was involved in the development and execution of the studies that supported that product as well. So. That's a little bit. I have to be careful not to go too deep down any of those pathways, but that's kind of what my background is.
Well, very impressive. I guess we are huge fans of your work, and we truly appreciate your contributions to our practice. And we will touch on the digital tool that you just mentioned. But first, let's talk about what are you excited about when it comes to behavioral health care in general?
Yeah, it's funny. I saw this question and I thought there's probably, it's a great question because I think it's easy as a mental health, behavioral health care professional to think about the things that we're frustrated by and the fact that we have a crisis in our country across all ages in terms of rising rates of mental health challenges. And there are other reasons and there's challenges with access to care and reimbursement and parity, but there are things that I'm actually excited about and optimistic that I think actually tackle some of those challenges. I think the biggest thing, Nada, that I'm excited about is where we are at in terms of being able to leverage new technology to improve behavioral health care. There's a whole wide range of ways that that's happening. So when I left academia, I was a faculty member for many years. When I first left, I went to work for a big data company, and we were working exclusively in the mental health field and trying to use de-identified electronic health record data to solve questions that we can't answer in normal clinical trials.
Okay.
And that's an advance, the use of large data sets and really leveraging what we call real world data and real world evidence. That's a new phenomenon. It's been around for much longer in other therapeutic areas, but bringing that to bear in behavioral health care is new, and that's exciting. And then when we think about all the different ways that technology is improving practice or access to practice, from things as kind of seemingly mundane as telehealth and being able to, to have mental health visits, on your phone, that's exciting, to, all sorts of apps and ways to track, functioning and symptoms and things like that over time. So I think we're just at the beginning of really understanding the best ways that we can leverage technology to improve, and that's exciting to me.
I guess if nothing else, it will allow for better accessibility to mental health and help and
In
reducing stigma around the whole thing, I'd say. What do you
Absolutely,
think? Yeah.
I think that, well, I think those are two different challenges that, but that I think technology can help to tackle. The access, we do have to be mindful that technology, in theory, should improve access. Unfortunately, at least from when we look in recent years, since there's been this huge spike in telehealth, for example, it hasn't really changed the patterns of who gets access to care versus who doesn't. In other words, some of the same health disparities that existed like 5 years ago have not really changed that much. So we've got to be, it's not just having a tool that provides access, but it's making sure that we're engaging with the people who are in need of that. So I think you're right, but I'm a little guarded about just saying, oh, it's just access. It's access and engagement, which is really important.
Thank you for clarifying that. And please tell us now, what are you excited regarding our work at Animo Sano Psychiatry?
Yeah, well, I've obviously I've been a friend and colleague of Mina's for a long time, Dr. Bozak, and I think a lot of a lot of your first two questions factors into why I'm excited about the work that you guys are doing. Number one, I think you are not exclusive, but you, as I understand it, you are focusing largely on people with ADHD, which is important.
True.
And I think often, especially adults with ADHD,
True.
there's not very many people that get specifically trained to treat adults with ADHD. Adult psychiatrists don't get that much exposure. Certainly, internal medicine and more generalists don't get exposure like a pediatrician or a child psychiatrist might. So I think that having a practice that has a real subspecialty focus is important, because there's so many people that are affected. And then also, you guys are also thinking innovatively about how to use technology, how to and not. I think another thing that I think maybe needs to be said out loud, because I just automatically assume, but using technology can also really, really improve the way that we use data and evidence to guide our practice.
True.
And I think that's exactly what you guys are doing. You can collect information. So rather than having somebody come and, you haven't seen them in a few weeks or a month, and you say, oh, how are things going? That's not a very reliable piece of information. If you've got data that you can, get from the people over time and review that really leads to better care. So I think you guys are walking the walk in terms of really, using technology, using evidence-based care, focusing on a population that's in need.
Thank you. Thank you so much. Yeah, we definitely try to do that, and not just in medical side of the practice, but with all work that we are doing, we are really focusing on KPIs, how you popularly call them, and
Yes,
trying
absolutely.
to do our best month after month based on data that we have. So, and of course, our patients like to call Mina Dr. V, and of course, himself and the whole team, they're doing a fantastic job. So, I'd say those go hand in hand, really,
Yeah,
and
for
just
sure.
boosting each other. So, one wouldn't be possible without the other. So, but thank you so much for your kind words. Now let's focus on your work, and I'm very
Mhm.
excited to learn more about this digital tool for ADHD that your company invented. So I would
Yep.
like to know, how does it help ADHD management, and then we'll talk about um, who is it made for, and how
Yeah.
people can start using it. But let's describe the tool a
Yeah.
bit
Yeah.
now. Thank you.
Maybe I'll start at the top.
Mm-hmm.
So we have, our company is Akili. It's called Akili,
Mm-hmm.
Akili, and
Mm-hmm.
we are currently marketing a product that is an app-based video game.
Mm.
Right now, it's for kids with ADHD between the ages of 8 and 12.
Mm-hmm.
We will soon be submitting to the FDA for a label expansion to go up to age 17.
Okay.
And we've got really good clinical trial data in adolescents. This is an FDA authorized product, so we've
Mm-hmm.
gone through the whole process of being regulated, running pivotal studies, and actually just 2 days ago we announced the results of an adult study, which I
Okay.
think might be really relevant to your practice, where the
Yes.
results that we saw in adults were even stronger than what we saw in kids or adolescents. They were really, really exciting results for us. I'll come back to how
Mm-hmm.
people can access that, but so the treatment itself was developed in an academic laboratory out at University of California, San Francisco, over
Mm-hmm.
10 years ago.
Mm-hmm.
And a person there named Adam Ghazali was interested in um, games for health and games for brain health. And so
Mm-hmm.
he developed this prototype where, and he gave it to older adults, and saw that it had this really profound effect on on their cognitive functioning.
All right.
And the effects they were correlated with changes in the brain. They were also durable, so that people, once they played the game for about a month,
Okay.
6 months later, they still showed the gains that they had made in their cognitive functioning. And so that was the origin of the company. And they said, okay, we've got this treatment, really helps with attentional control. What's a population that we can focus this on? And
Mm-hmm.
ADHD was an obvious solution. So
Mm.
that's kind of where I got involved. We ran several studies to support its efficacy. It's obviously a very safe product, very low rates of side effects in our clinical
Mm-hmm.
studies. And to the question of, how does it help with ADHD
Mm-hmm.
management?
Mm-hmm.
What we have shown repeatedly now, I think now that we have released our adult data, we have studied this in 7 clinical trials in almost 1,000 patients,
Mm-hmm.
where we see the biggest robust improvement is in just pure attentional functioning. So,
Okay.
and we measure that objectively with a computer-based measure of attention. It's called the TOVA, the Test of Variables of Attention. And we show that people, where they start and then where they finish after 4 to 6 weeks of treatment is
Okay.
dramatically improved. Um, Now, a lot of people say, well, okay, great, the TOVA, what does that mean? I don't care that much about the TOVA because I have ADHD and
Uh-huh.
it's affecting my day-to-day functioning. So what we have also measured in our studies are symptoms of ADHD as well as ADHD related impairment. So
Mm-hmm.
how ADHD kind of gets in the way and disrupts what you're doing in your day-to-day functioning. And we've also seen significant improvements on those outcomes as well. For example, I'm really excited about this because we just announced the data, but
Mm-hmm.
in our adult study, we included a measure, an ADHD specific measure of quality of life,
All
which is,
right.
you know, it's how, how are you functioning? How are you completing tasks and getting stuff done, and misplacing things, and your relationships with other people. And we saw
Yeah.
about 3/4 of people in the study saw some improvement in that, and almost 50% saw a significant improvement that was sort of a pre-specified threshold
All
for
right.
really, really good response. And this is after that was after 6 weeks of using the product a few times a week.
All right. So how, I guess this is a product for everyone at the moment.
Yeah.
It's tested and approved just for kids, but you will be working
Yes.
on making it available for literally
Yeah.
everyone. So maybe
We absolutely are. So I'll tell
yeah.
you, I'll tell you how to, you raised the question before about, how can listeners access this? So
Yes.
right now, today, this is a prescription only product. So it needs it needs somebody to write a prescription.
Okay.
You fill it through an online service that you can download the app right now. You can go to the
Mm-hmm.
App Store or Google Play. It's called EndeavorRx. You can download it. You can do a demo, but you
Mm.
can't activate the treatment until you get an activation code, and that's what you get with a prescription. Right
Okay.
now, it is approved for kids 8 to 12.
Mm-hmm.
Like I said, we are submitting soon to the FDA to allow us to market it to older kids up to age 17, and especially now with the adult data that I was just
Mm.
describing, we are working really, really fast to get
Okay.
this into the hands of patients as quickly as possible. So
Mm.
it is not directly available for adults yet,
Mm.
but stay tuned. If you check back with me in a month or
Okay.
two, and I
A
will
month or
probably
yeah, I
have some
wanted to ask
updates.
about the estimates. So month or two doesn't sound that bad. So I guess it will be here soon enough.
Well,
Yeah.
we'll have more to say about how and when it will be available in a month
All
or two.
right.
We're sort of evaluating right now,
Okay.
what our best strategy is to
Okay.
get this into the hands of patients that
All
can
right.
benefit.
All right. All right. Well, we'll be sure to stay on top of this and let our listeners and the community know when this is available. I guess it's pretty awesome and pretty useful.
Exciting.
All
Yeah,
right.
it's really exciting.
Yeah. So if there is one thing you'd like our listeners to remember from this episode, if you have any words of wisdom or advice for ADHD management, what that would be.
Yeah, that's always a good and a hard question. I think
All
uh, I would say a couple things. I would
right.
say number one, and this might not have as much to do with management as it is
Mm,
just a message to patients. Having
mm,
worked in
mm,
the ADHD field for
mm,
my whole
mm, mm, mm.
career, I hear from a lot of patients that they feel like that ADHD is not, oh, it's not that big of a deal. It's not as
Uh-huh.
severe as if you're severely depressed or if you have a psychotic disorder or something like that.
Yeah,
And I
yeah, yeah,
think that just to remind your listeners who might be affected that we get it, clinicians get it. This is not just an inconvenience. This is something that really, really does impact everybody,
yeah.
across the lifespan, across you know gender
Mm,
and ethnic groups and socioeconomic status and so forth. So you are not alone if you're feeling like, this is really, you know
yeah.
really, really bothering me, but people
Uh-huh.
aren't taking it seriously. And then in terms of care management, I would say that um, be assertive and
Mm,
talk to your providers and be open and
mm,
about what you need.
mm,
Right now, I mean, there are good treatments that are
mm,
available. A lot of times those treatments, they don't work as well if they are not implemented in a way that's careful, like what you guys do at the practice,
mm-hmm, mm-hmm,
paying really close attention, specializing in an area, collecting data. And then
mm,
also, my own bias, given what I just described for my
mm-hmm.
company, is that there are options out there. If you've got if you're trying things that are
Yeah.
standard of care that are out there and they're not working as well, there are options. So,
Correct.
but you've got to have that good relationship with your care provider to make sure that you can get access to those.
That's great advice. Thank you so much. I guess there is a lot of stigma in terms of ADHD being considered as a moral failure, and
Absolutely.
yeah. So I guess there's a lot of that in asking for help and approaching and taking care of
Completely.
yeah.
Yeah,
But hopefully with all this work that we are doing and with this podcast as well, I hope we are changing the narrative one story at a time, one patient at a time, and I really hope
I
things
hope
are
so.
changing for the better. So to conclude this conversation, if people want to learn more about you and your work, Scott, how they can do it?
Yeah, I think that I'm on LinkedIn.
Mm-hmm.
I'm relatively easy to find because my last
Mm.
name is spelled kind of unusually. It's
Yeah.
Kollins with a K.
Okay. Yeah.
I am also from a scientific perspective. If you go to PubMed or Google
Mm.
Scholar,
Mm-hmm.
you can take a look at the research that I've done,
Mm-hmm.
and then also, of course, our company, like I said, is Achille.
Yep.
Information about our product, which is EndeavorRx, is there's a website that's just Endeavor, EndeavorRx.com.
Mm-hmm.
It has all the information about the treatment and the research that we did to support it and so forth.
Thank you so much. We will make sure that we have all this information available in the show notes so people can easily access everything that you shared with us at the moment. Thank you so
Excellent.
much. Thank you so much for this conversation. It was absolutely brilliant. I really enjoyed it. I hope our listeners learned something new, got some new ideas about ADHD management, and also just a bit of encouragement to keep going, keep fighting. So thank you so much.
Absolutely.
Yeah,
Of course. It's my pleasure, Nada.
thank you. Thank you for listening to Thriving with ADHD. This show is produced by Animo Sano Psychiatry. Please follow, rate, or share our podcast on Spotify, Apple Podcasts, or any other streaming app of your choice. Music is by Daddy's Music from Pixabay. For more information about Animo Sano Psychiatry, please visit animosanopsychiatry.com.